Tonight, we're diving into a decision that has sparked intense debate across the United States: the confirmation of Robert F. Kennedy Jr. as the nation's new Secretary of Health and Human Services. In a razor-thin Senate vote of 52 to 48, Kennedy now leads one of the most powerful agencies in the federal government, a role that places him at the center of America's public health strategy. But this appointment hasn't come without controversy. Known for his skepticism toward vaccines and his outspoken criticism of the medical establishment, Kennedy's leadership raises critical questions about the future of U.S. health policy. So tonight, we'll break down the details of his confirmation, explore expert opinions, hear from the public, and examine what this could mean for the future of healthcare in America. Let's get started. Robert F. Kennedy Jr., a prominent environmental lawyer and member of the storied Kennedy family, is no stranger to controversy. At 71 years old, he steps into a role overseeing a $1.7 trillion agency responsible for institutions like the CDC, FDA, and CMS, organizations that play pivotal roles in safeguarding public health. The Senate vote was deeply polarized, with all Democrats opposing his nomination. Even within his own party, there was dissent. Republican Senator Mitch McConnell broke ranks, citing concerns over Kennedy's vaccine skepticism. During his confirmation hearings, Kennedy faced tough questions about his past statements linking vaccines to autism, a claim widely discredited by the scientific community. He assured lawmakers that he would base vaccine recommendations on evidence-based research and pledged not to interfere with vaccination efforts. Kennedy also emphasized his commitment to addressing chronic diseases, improving nutrition, and increasing transparency in how federal health agencies operate. But while some see promise in his focus on accountability, others worry that his views could undermine decades of progress in public health. With so much at stake, let's turn to what experts are saying about this historic appointment. To better understand the implications of Kennedy's leadership, we spoke with leading voices in the medical and scientific communities. Dr. David Noonan, Senior Research Fellow at the Center for Evidence-Based Medicine at the University of Oxford, acknowledges Kennedy's critique of conflicts of interest within organizations like the FDA. However, he warns that Kennedy's approach may lack a strong foundation in evidence-based science, potentially challenging long-established public health practices. Professor Sarah Berry, an expert in nutritional sciences at King's College London, sees an opportunity for meaningful change. She highlights Kennedy's stated goals of improving school food programs and reducing the prevalence of ultra-processed foods as steps in the right direction, if implemented effectively. Ensuring that public health interests take precedence over corporate profits could indeed be transformative, she argues. But not everyone shares this optimism. Dr. David Elliman, a consultant pediatrician at Great Ormond Street Hospital for Children, expresses deep concern over Kennedy's stance on vaccines. He warns that perpetuating misinformation about vaccines could erode public trust, leading to lower vaccination rates and outbreaks of preventable diseases. For Dr. Elliman, the stakes couldn't be higher, especially when it comes to protecting vulnerable populations like children. Clearly, opinions are divided, and as we'll see next, the same can be said for the general public. The reaction to Kennedy's confirmation has been nothing short of polarized. Supporters argue that his appointment brings fresh scrutiny to a system they believe has grown too cozy with Big Pharma. They applaud his calls for greater transparency and accountability, viewing him as a champion for reform. Many hope his leadership will prioritize holistic approaches to health, tackling issues like obesity and chronic disease through innovative policies. Critics, however, paint a very different picture. They point to Kennedy's history of vaccine skepticism as a red flag, fearing that his leadership could embolden anti-vaccine movements and jeopardize decades of progress in controlling infectious diseases. Social media platforms have lit up with heated discussions, reflecting the deep divisions this appointment has exposed. Some parents express alarm over potential risks to their children's health, while others welcome Kennedy's promises of increased oversight. It's clear that this confirmation has struck a nerve, and its impact will likely ripple far beyond Washington. So, what does all this mean for the future of public health in America? Kennedy has outlined ambitious priorities, including reviewing vaccine safety protocols, eliminating harmful chemicals from food supplies, and investing in research on chronic diseases. On paper, these initiatives sound promising, but they also raise serious concerns. Critics worry that his emphasis on reevaluating vaccine safety could sow doubt and confusion, undermining confidence in life-saving immunization programs. Internationally, the stakes are equally high. As a major funder of global health initiatives, any shifts in U.S. policy under Kennedy's leadership could have profound effects worldwide. Experts fear that his views might hinder international efforts to combat infectious diseases or disrupt collaborative research projects. At home, the balance between innovation and adherence to scientific consensus will be crucial. Will Kennedy's tenure usher in meaningful reforms, or will it set back decades of progress? Only time will tell, but one thing is certain: his decisions will shape the trajectory of American healthcare for years to come. As Robert F. Kennedy Jr. takes the reins of the Department of Health and Human Services, the nation finds itself at a pivotal moment. His leadership holds the potential for both groundbreaking reforms and significant challenges. Supporters and critics alike will be watching closely, eager to see whether his vision aligns with the needs of a diverse and complex population. This story is far from over, and staying informed is more important than ever. We want to hear from you. What are your thoughts on Kennedy's confirmation? Do you think his leadership will strengthen or weaken America's public health system? Share your perspective in the comments below. And if you found this analysis helpful, don't forget to give us a thumbs up and subscribe to our channel for more in-depth coverage of the issues that matter. Thanks for joining us tonight, and we'll see you again soon.